This video will show the management of subluxated IOL with SF IOL by Yamane technique by Dr. Sri Ganesh. We make a port to maintain the globe and the anterior chamber, and then we try to levitate the IOL. Now we make the first side port with the help of a diamond blade. Now we enter the main port in the AC. We inject the viscoelastic substance. Through the side port, we insert a forceps to hold the haptic of the IOL and free the capsular adhesion by anterior vitrectomy. Now we use a scissor to cut at least 3/4 of the optic of the IOL. Then we pull out the IOL through the main port along with the bag. Then again anterior vitrectomy is done. Then we make a second side port. We use the iris hooks to retract the iris. The iris hook is inserted through the side port. We load the IOL, 3-piece IOL, and keep it ready. Then we mark 0, 180 degree axis. And also we mark 2 mm away from the limbus, which will be perpendicular to the 0 and the 180 degree axis. And we enter the PC through the transconjunctival route through a 27 gauge needle. Then we insert the IOL through the main port and inject it in the AC. Then the trailing haptic is threaded in the 27 gauge needle and it is externalized and it is cauterized to form a flange. The same step is repeated in the other side. The other haptic is also threaded in the needle and then externalized. It is then cauterized. It forms a flange of about 0.75 millimeter. Then the iris hook is removed. Anterior chamber is washed well. And all the ports are checked. And hydration is done. We put a suture in the main port to avoid any leakage. The conclusion and the take-home message is that the flange IOL fixation technique is a simple and minimally invasive method for achieving a good IOL fixation with the firm haptic fixation.